Hi, I'm Dr. Adatone Musa.
Hi, I'm Dr. Hussein Musa.
I'm a board-certified neurologist and epileptologist.
I'm a board-certified pain doctor, anesthesiologist, and addiction medicine specialist.
And today we are going to talk about gaps in healthcare and how direct care can help.
Yes. Now, today's issue, we're going to talk about migraines
Yeah, migraines.
and headaches.
What are headaches and migraines?
Well, I'm not going to call my children and wife headaches and
my goodness.
migraines.
No.
They are the loves of my life. But at times, they can lead to this process that develops something. Okay, I'm done with that. I'm going to let you talk.
Please.
Sorry. Yeah,
So,
slinking off camera.
A headache, a headache is an umbrella term for any sort of pain or pain disorder involving the head. Migraines are a little bit different. You know, typically a migraine is one-sided. It's a throbbing type of pain. You may have nausea. You may have light sensitivity. You may even have some other associated symptoms like an aura, which typically occurs before the migraine.
What is an aura? Is it like a wavy light or something like that?
Actually it is. A lot of the aura described in literature is something visual. So a patient may see flickering lights, what we call scintillating scotoma.
That's a fancy word.
Yes, it is. Yes, but it you know, typically you'll see that sort of thing in a patient's history with migraine.
Yes, and I bet if you have time and you've worked with enough migraine patients, you may see that aura as something else. It can be a different sense.
It can be. It can be even something like tingling or a sensation on one side of the body. It's actually very important to see the doctor if you have any of these symptoms to determine if it's an aura or if it's something else.
Now, is it possible to confuse migraines with seizures?
Yes, it is. And in fact, sometimes seizures will lead to a migraine type or headache type of experience.
I wonder how much time does it take to actually figure that out?
It takes a lot of time. It's really great to see a primary care doctor. But if you're suffering from these conditions, and let's say they become more and more frequent, then you should see a neurologist. And to boot, if you have migraines, and the migraines are just not going away, they're severe, you've been suffering for 2 to 3 days, you're contemplating going to the emergency department for IV medications, that's another thing that direct care and fast access to a neurologist can take care of as well.
And I think that's an amazing combination that we have in our direct care practice, having a neurologist and a pain doctor. And at least in our field, there are certain injections that we can do to help with migraines. We can inject the muscles that can cause tension type headaches that can lead to a migraine. We can also do nerve blocks that can relieve some of the pain, depending on the origin of your headache.
Yes.
And oftentimes, even IV medications as an anesthesiologist, we're really good at placing IVs and doing that type of thing. So I can imagine that if you have been suffering from a migraine for days and you go to the ER, you get to wait, I don't know, it can be a very long wait.
It can be a long wait, you know, because the ER or ED typically has to triage a patient. So that means they will prioritize a patient based on their complaints.
So, well, migraines aren't life-threatening, so it may hit a little bit lower,
a little
bit lower, but
yeah.
Yeah, and one thing that I would say is a benefit of a direct care specialty practice is if you have access to your doctors and they can treat this condition, you can save yourself an emergency room visit and that emergency room bill.
Yeah, definitely saves money that way. And so there's so many different migraine treatments, both acute treatments and also preventative treatments as well. We'll have to go into that next time.
Headaches can be a real headache.
Funny.
Okay.
Another dad joke.
Yeah, I'm going to end on that note. Well, that's all the time we have for today.
Thank you so much. Visit us at kingdomdocs.com for more information.
God bless.